Hi everyone, Whitney Lowe here again from the Academy of Clinical Massage, and today on our Clinical Insights video we're going to be talking about an important strategy when you're trying to determine what is the best way to address a particular type of pain and injury complaint, and we're going to focus on something called the Rehabilitation Protocol. And just to give you a little bit of background on where this idea came from, I spent a number of years working in clinical environments with clients and patients that were being referred in from other healthcare professionals. And I kept seeing a pattern happening over and over again where some people would be referred into massage after having gone through another type of treatment and their condition actually got worse. Maybe they were given some vigorous exercises to do that were supposed to be getting them better, but they actually got worse. Now that's going to happen with certain types of interventions, but this was happening more frequently than it seemed like it should. And what I recognize is that there's really a stage or sort of a sequential process that people go through with every type of injury condition, from the standpoint of where it's at its worst when they first come to see you and what's going to happen as you begin to get that condition better. And so we've structured that into something we call the Rehabilitation Protocol, and it has these 4 different stages. So today I want to go through the 4 different stages of that Rehabilitation Protocol with you, because this will help you in the process of creating an effective treatment plan and know when you should be doing what types of things with your clients and recommendations for them that might be helpful outside of what you do in the treatment room. So the first step in this rehabilitation protocol we're going to call normalizing soft tissue dysfunction. And essentially what that means is we try to look at what the nature of the problem is and see how we can first address the main tissue problem or dysfunction that we're presented with. So for example, if this is a muscle strain, normalizing soft tissue dysfunction means addressing the torn muscle fibers, any potential scar tissue that's there, and anything that's adding to or aggravating that particular complaint. If it's something different, like chronic myofascial trigger points or just chronic tightness and hypertonicity in a tissue, the approach is going to be different because we're going to be focusing on the neurological components that are perpetuating that type of tissue dysfunction. So you can see this is where assessment plays a key role, because we have to identify the nature of the problem in order to determine the most effective way to address that soft tissue dysfunction to begin with. So first step, normalize soft tissue dysfunction. The second step is to improve flexibility of those tissues. So this is going to happen as we begin to get a handle on the soft tissue dysfunction. We want to encourage elasticity, pliability in all those tissues and get them as flexible as possible. We're aiming to restore ideal movement patterns. So once we can restore that flexibility in those tissues, because in so many cases we've got chronic muscle tightness or something that's limiting range of motion or limiting full mobility of those tissues. So we're going to try to restore them as much as possible back to a state of ideal flexibility and mobility. Now it's also important to remember that you don't necessarily finish one stage completely and then move on to the second stage and then finish that completely and then move on to the third stage. There's going to be overlap between all these different steps. But as a general guideline, we want to see us moving progressively through these different stages in this order. Now, the third stage is what we call restoring proper movement patterns. This means that once we've reestablished that flexibility and gotten the tissue dysfunction addressed, we want to also deal with the things that may be perpetuating this problem, like dysfunctional movement patterns, ergonomic changes. Like maybe somebody's got a neck injury and it's aggravated because they have a monitor where they're constantly turning their head to the side at their workstation. We want to change those movement patterns because it is the movement patterns that reinforce that dysfunctional process or dysfunctional movement in there. And that condition is likely to perpetuate and just continue happening over and over again if we don't address those recurring dysfunctional movement patterns. So we try to restore ideal proper movement patterns as our third stage in that rehabilitation protocol. And then the final stage we get to is the strengthening and conditioning. So again, this is where an error is frequently made, is jumping into that last stage of strengthening and conditioning too quickly. If a person is given a lot of exercises or activities to do before they're really ready for it. Or this also happens in instances where a person is maybe super excited to get back to an activity that they've been impaired from doing, and they go back and they start doing it too soon. That's again a way in which they're trying to do conditioning or activities beyond the level of what those tissues are prepared for. So we have to remember that there's limits to what you can do at each of these different stages, and we want to see the person gradually moving through the progression so they can get to each of these different stages and be able to get the ideal process of their rehabilitation done as efficiently and effectively as possible. And we want to do something that's going to last. So one of the things that I want to emphasize here from a treatment perspective is it's really important for the practitioner to identify what their goals are and what the guidelines are to help get each client moving through that rehabilitation protocol. And remember, it's going to be different for each person. There are numerous unique facets that are going to determine how quickly somebody can move through this. Like, how bad is this injury? How recent is it? How long has it been going on? Because something that's been going on for a long time is going to take a longer time to get better and move through that process than something that's a relatively recent acute injury. So keep in mind there's all kinds of other clinical decisions that we want to make that are going to help us determine the most effective way to bring our clients through these different stages of the rehabilitation protocol. This is also going to help us in picking and choosing different techniques that we will use, different techniques on what we call the ladder of engagement. We've addressed that in some other videos as well, to look at what's going to be the type of techniques that will be most effective at each of these different stages. So if you want to learn more about the rehabilitation protocol and see some other ways to really put that into practice with specific pain and injury conditions in your massage practice, come join us here at the Academy of Clinical Massage in our orthopedic massage programs, and we'll go into that in greater detail. You can find information about our programs over on our website at academyofclinicalmassage.com. So thanks again for joining us today, and we'll see you in the next video.